Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Ever stop to think about um, how we were raised might influence how we raise our own kids?
Mm-hmm.
It turns out those early experiences can have a really long shadow.
They really count.
Today, we're diving into some, fascinating research that kind of peeks into why patterns of childhood mistreatment sometimes repeat across generations.
Yeah, this is a really interesting study. It just came out from researchers at the University of Fukui in Japan, published in Scientific Reports.
Right, scientific reports. So we'll be digging into the actual scientific paper itself.
Yes, absolutely. We'll look closely at the original paper and maybe also touch on some highlights from a health news article that covered the work.
Okay, great. So listeners, if you've ever wondered how your own childhood shapes your parenting, or maybe what's behind those really difficult cycles of behavior, well, this deep dive is definitely for you.
Yeah.
We're going to explore how tough early experiences for mothers might affect their empathy, basically, how they connect with others' feelings.
Exactly, and how that connection or lack thereof in certain ways might unfortunately play a part in that cycle of abuse.
And maybe what the study suggests about ways to help, ways to intervene.
Mm-hmm.
So let's start there. What was the main thing these researchers in Japan were really trying to figure out?
Well, they were trying to get a really detailed understanding of the differences, between mothers who've been involved in child maltreatment situations and mothers who haven't.
Okay.
But importantly, they weren't just looking at it as black and white, like maltreatment happened or it didn't. They wanted to see it more as a spectrum.
Ah, okay. Like shades of gray.
Precisely. Looking at how a mother's own history of difficult childhood experiences, her ability to empathize, her mental well-being, how all these things might connect and influence each other. They were searching for the nuances.
That makes sense. It's rarely simple, is it?
Yeah.
So how did they actually, go about studying this? What was the setup?
So they worked with two groups of mothers. The first group had 13 mothers who had a known history, basically involvement with social services because of their own childhood maltreatment experiences.
Okay, a group with that specific history.
Right. And the second group was a control group, 42 mothers, matched for age, without that specific history.
Got it. And how did they analyze the information? You mentioned nuances.
Yeah, the main statistical tool they used is something called path analysis.
Path analysis, okay.
Think of it like a detective mapping out connections between clues at a crime scene.
Ah, I like that analogy.
Each piece of information they gathered was a clue, and path analysis helps see which clues are strongly linked and how they might, lead from one thing to another, like a chain reaction.
Okay, so they have the two groups, the detective work analysis.
Yeah.
What kinds of clues, what information did they actually collect from these mothers?
They used quite a few different psychological assessments. To get a picture of the mother's own childhoods, they used the Adverse Childhood Experiences questionnaire.
Right, the ACE score, I've heard of that. It gives a broad overview.
Exactly. Difficult events, household dysfunction, things like that. But they also used the Childhood Trauma Questionnaire, the Japanese version specifically.
Okay, and that's more detail.
Much more detailed. It asks about specific types of experiences, psychological abuse, physical abuse, sexual abuse, and also emotional and physical neglect. Really gets into the specifics.
Wow, okay, so a deep dive into their pasts. What about empathy? You mentioned that was key.
Yes. For empathy, they use the Interpersonal Reactivity Index. This is interesting because it breaks empathy down into different parts.
Oh, it's not just one thing.
No, not at all.
Yeah.
So there's perspective taking, trying to see things from someone else's point of view. Then empathic concern, which is that feeling of warmth or compassion for someone who's suffering.
Okay.
There's also fantasy, the tendency to get really drawn into the feelings of fictional characters. And crucially for this study, personal distress. That's feeling anxious or uncomfortable yourself when you see someone else suffering.
Okay, so feeling their pain almost too much, maybe.
That's one way to think about it. Yeah, it's a distinct reaction.
So they covered past trauma, different facets of empathy. What else did they measure?
They also assessed the mother's current mental well-being using the self-rating depression scale. just to gauge subjective feelings of depression.
Makes sense.
And then parenting itself. They used the parenting scale again, the Japanese version, which looks at parenting practices, specifically things like being too lax or inconsistent versus being overly reactive or harsh.
So dysfunctional parenting styles, basically.
That's what it's designed to measure, yes. Oh, and one more thing, they actually took a biological measure too.
Oh, really? Like what?
Saliva samples to measure levels of cortisol.
The stress hormone.
Exactly. To see if there were physiological stress differences between the groups.
Wow, that is comprehensive. Past experiences, emotions, mental health, parenting, and biology. So after gathering all that data, what did they find? What were the big takeaways?
Well, one of the first things, and maybe not entirely unexpected, was that the mothers who had that history of childhood maltreatment reported, well, significantly higher levels of all types of difficult experiences on both the broad adverse childhood experiences measure and that detailed childhood trauma questionnaire.
Right. So their own reported experiences match their known history. That makes sense.
It really does. It underscores how significant those early experiences felt to them and how they're recalled later.
What about their current state? Mental health, empathy, were there differences there too?
Yes, definitely. That group, the mothers with the history of maltreatment, they also scored significantly higher on the depression scale.
Okay, so more depressive symptoms.
Correct. And for empathy, using that interpersonal reactivity index, the key finding was that this group scored significantly higher on the personal distress part.
So that feeling anxious and uncomfortable when seeing others suffer, that was higher in the group with past trauma.
Exactly. Which is really interesting. They also scored higher on the fantasy scale, that tendency to identify with fictional characters.
That is an interesting mix. More distress from real suffering, but also maybe more connection to fictional worlds.
It seems that way based on these scores, yeah.
So how did all these pieces fit together? This is where the path analysis, the detective work comes in, right?
Exactly right. That's what helps map the potential connections. So when they looked at all the mothers together, both groups combined, they found a clear positive link between the total score on that childhood trauma questionnaire
So more past trauma.
and higher levels of depressive symptoms.
Okay, that seems intuitive.
And they also found a positive link between that feeling of personal distress, what we can call affective empathy here, and depressive symptoms in the whole group.
So more personal distress when seeing others suffer was also linked to more depression.
Yes. Across the board, it seems.
So, connecting the dots. Does this mean the past trauma and the personal distress are linked to the risk of child maltreatment itself?
The analysis pointed in that direction. It suggested that a history of difficult childhood experiences was positively related to the risk of engaging in child maltreatment,
Okay.
and that this link might be sort of mediated by the level of depressive symptoms the mothers had. Like, depression could be part of the pathway.
So trauma might lead to depression, which in turn might increase the risk.
Potentially, yes. Now, things got even more complex and maybe more interesting when they looked only at the group of mothers who had experienced maltreatment themselves.
Okay, what did they see within just that group?
They found that higher scores on the childhood trauma questionnaire, so more severe past trauma, were associated with higher levels of that personal distress type of empathy.
Right, we saw that difference between the groups already.
Yes, but here it's showing the link within the group. And that higher personal distress, in turn, was linked to higher depressive symptoms.
Okay, so trauma, more personal distress, more depression. That seems to follow.
But here's a twist. In this specific group, higher levels of depressive symptoms were actually correlated with lower scores on the overall parenting scale.
Wait, lower scores, meaning less dysfunctional parenting as depression went up.
It suggests less of the excessive parenting styles measured by that scale, like overreactivity or harshness, as depression increased in this specific group of mothers with a history of maltreatment.
That is not what I would have guessed at all.
It's definitely a nuanced finding. It made the researchers dig a bit deeper within that group.
Yeah, what did they find?
They found that it was the mothers with moderate levels of depressive symptoms, not the lowest, not the highest, who actually showed the highest scores on the parenting scale.
So the most dysfunctional parenting practices were seen in the mothers with moderate depression, specifically within the group that had experienced past trauma.
That's what this suggests, yes. So it's not a simple linear thing where more depression always equals worse parenting, especially in this context. It might be that middle range of depressive symptoms that's particularly challenging for parenting in mothers with this history.
Fascinating. It's like a specific zone of difficulty.
Yeah.
What about the cortisol, the stress hormone? Did that play a clear role?
It was a bit ambiguous. They did see a trend. The maltreatment group tended to have slightly higher cortisol on average, but the difference wasn't statistically significant between the two groups overall.
So not a clear biomarker difference there.
Not definitively between the groups based on this single measure. However, in one of the path analysis models looking at everyone, cortisol levels did seem to significantly influence the risk of abuse.
Ah, okay. So it's still potentially part of the picture, just maybe not in the simple way.
Exactly. It suggests stress physiology is likely involved, but maybe interacts with other factors, or perhaps they needed more measurements or a larger group to see it clearly.
Okay. So pulling this all together, we're seeing these complex links between a mother's own childhood, her emotional responses like empathy and distress, her mental health, particularly depression, and then how that might influence parenting. What are the big implications here? What should we really take away?
I think a really crucial point is how experiencing maltreatment in childhood seems to actually enhance a certain type of emotional empathy, that personal distress component.
Right. Feeling others' pain more intensely.
Yes. And while we usually think of empathy as good, this study suggests that if that heightened personal distress isn't managed effectively, it can actually feed into increased feelings of depression for these mothers.
So their intense empathy, in a way, becomes a source of their own suffering.
That seems to be the implication, yes. And this pathway might be how a mother's traumatic past indirectly increases the risk of difficulties in her own parenting.
Through the impact on her emotional empathy, leading to personal distress, maybe leading to depression, which then affects parenting behaviors.
Exactly. That's the potential pathway the study highlights. It shows how sensitive and interconnected these things are. It's not just the past trauma, but how that trauma shapes present emotional responses and mental state.
That really drives home the complexity. It's not a simple cause and effect.
Not at all. And because we can see this potential pathway, it suggests where interventions might be helpful. Addressing both that specific kind of emotional empathy, the personal distress, and the depression in mothers with this history could be key.
So helping them manage those intense feelings.
Yes. The researchers themselves suggest that targeted support, like mental health services, specific kinds of therapy, maybe parenting programs that focus explicitly on helping mothers cope with overwhelming emotional responses, could be really beneficial.
So it's not just about teaching generic parenting skills, like use timeouts.
Yeah.
It's about supporting the parent's own emotional world first, especially if they've had these difficult early lives.
That seems to be a critical insight from this work, yes. Understanding this whole interplay gives us a much clearer picture of why these cycles can be so hard to break, but also maybe where we can focus efforts to make a real difference.
Yeah, that makes a lot of sense. Now, we always have to be careful with interpreting studies, right? Every study has limitations. What should we keep in mind here?
Absolutely. A few important points. First, a lot of the data relied on the mothers filling out questionnaires about themselves.
All reports.
Exactly. And self-reports can be tricky. People might not remember accurately, or might feel uncomfortable sharing certain things, or their current mood, like being depressed, could color how they answer, especially with sensitive topics like childhood trauma and mental health.
That's fair. It's hard to be perfectly objective about your own past and feelings. Any other limitations?
Well, that finding about cortisol not being significantly different between the groups,
Right.
the researchers noted this could be because the maltreatment group was quite small, only 13 mothers, and they only took one saliva sample. Maybe with more people, or measuring cortisol at different times of day, they might have seen a clearer difference.
Sample size is often a factor in these kinds of studies.
It definitely is, and that relates to the last main limitation. The overall sample size, especially for that maltreatment group, was small. This means we need to be cautious about generalizing these findings too broadly to all mothers with similar histories. It also might have affected how well some of the path analysis models fit the data.
Okay, so fascinating findings, potentially very important insights, but we need to see them as part of an ongoing picture, right? More research needed to confirm and expand on this.
Exactly. It's a valuable piece of the puzzle, but not the whole picture yet.
Did the lead researcher, Yuko Kawaguchi, comment on the study's goals or findings?
Yes, she did. She explained their aim quite clearly. She said the goal was to not only determine whether mothers engaged in child maltreatment in a simplistic either manner, but also to understand the act of maltreatment from a more nuanced spectrum-based perspective.
Right, reinforcing that idea of moving beyond simple labels.
Exactly.
Right.
And regarding the findings, she summarized it by saying, our research reveals that a history of abuse enhances emotional empathy, which in turn influences parenting through its impact on depression.
So really highlighting that central pathway we discussed. Trauma affecting empathy, linking to depression, impacting parenting.
Precisely.
And did she talk about solutions or next steps?
She did. She pointed towards the potential for intervention, stating, by addressing emotional empathy and depression, we can help break this cycle and prevent maltreatment from being passed down to the next generation.
That's quite hopeful, isn't it? The idea that understanding these mechanisms gives us tools to actually help.
It really is. It suggests that focusing on the emotional well-being of parents, particularly those who've experienced trauma, could be a powerful way to support families and prevent harm.
It's very encouraging to hear that directly from the researcher. So as we wrap up this deep dive, what's the core message, the main thing listeners should maybe mull over?
I think it's really about appreciating the deep, complex interconnection between our early lives, our emotions right now, and how we act as parents. This study provides some compelling evidence for how a mother's own difficult past can shape her emotional world, particularly that intense personal distress and her mental health, which then ripples out into her parenting.
Yeah.
It's a strong reminder that if we want to address these really tough intergenerational patterns, we can't just look at behaviors on the surface. We need to understand and support the underlying emotional and psychological experiences of the parents themselves.
That's a really powerful takeaway, looking beneath the surface. If this conversation has sparked anyone's curiosity, maybe look into resources on adverse childhood experiences or how empathy works, or perhaps local groups that support parents and kids.
Definitely worth exploring.
Ultimately, this research just hammers home the profound, lasting impact of our early lives. But it also hints at something really powerful, doesn't it? The potential we have by understanding and addressing emotional well-being to maybe shape a more compassionate future for families.
Thanks for tuning in to the Health Headliner podcast by Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.